but let me welcome the man who really helped to galvanize the county and the city and everybody together, Dr. Jonathan Fielding.
Thank you, Mr. Mayor. Thank you very much for those generous words, and thank you, Supervisor Yaroslavsky. And thank you all for helping to promote this important effort to ensure that H1N1 vaccine reaches every resident in the priority groups who wants it. Every year, influenza is a serious threat in Los Angeles County, but this year we face not only the usual seasonal flu threats, but we also face the H1N1, which is in essence a type of variant. It's not a lot different, but on the other hand, it appeared too late to be incorporated in the usual flu vaccine. And while most cases are simply mild or moderate, no worse than other seasonal flus, there are certain parts of the population, including children, pregnant women, and young adults who are at higher risk for severe complications. Just for a point of reference, so far in Los Angeles County, H1N1 has caused over 400 hospitalizations and approximately 60 fatalities. The H1N1 vaccine, which will be available throughout the season from doctors, pharmacies, and clinics, just like this one, is the best preventive measure that we have. There's no better prevention than vaccine. There are 6 priority groups that most people should know about, and those groups are the ones they should get the vaccine first. Those are pregnant women, caregivers of children under 6 months of age, children and young adults 6 months to 24 years, adults from 25 to 64 of underlying conditions like diabetes, like respiratory, like cardiac conditions, healthcare workers, and emergency medical service workers. These groups together constitute about half of the overall population. More than 3,000 providers in this county have signed up and will receive the H1N1 vaccine from the manufacturers, and they are starting to deliver it. Yes, it is unfortunately coming later than we would like in smaller quantities, but the good news is that that it has started to arrive, and that's why we're able to start our clinics today. In addition, the H1N1 vaccine will also be available through some chain pharmacies throughout the county starting sometime in very early November. The Centers for Disease Control is providing the vaccine free of charge to doctors and pharmacies, and then allowing them to charge only a small administrative fee to ensure its availability to the public. But what if you don't have a doctor? Or what if your doctor didn't order the vaccine? Or what if you don't have health insurance and can't afford the administrative fee? That's where public health steps in. A list of clinics is available online at our website, publichealth.lacounty.gov, or you can call the county's hotline at 211. Our list will be rolled out 2 weeks at a time, so check back frequently to find a public health vaccine clinic near you. Now, we are set to receive weekly shipments, and we are not expecting lasting shortages. The federal government has ordered over 250 million doses to be manufactured, so the only question is how quickly it's going to get here. But there will be sufficient vaccine. As Supervisor Yaroslavsky mentioned, this vaccine has a very good safety profile. It is safe and it is effective, and it can prevent flu in up to 90% of healthy adults under 65 years of age. Also, let me be very clear that flu vaccinations do not cause the flu. I want to say that again. You can't get the flu from getting a flu shot or the nasal spray vaccine. It was created using the very same methods and same technologies that made the seasonal flu shots for years and the nasal spray that we've had for years. They have excellent safety records. That's why you saw me getting my own vaccination inside and providing it to others in the high-risk group. I got one because I am providing those shots and coming in contact with a lot of patients in that process. So do your part, protect your health and the health of others. As Supervisor Yaroslavsky mentioned, this is the largest vaccine effort in our history, and we're focusing on providing this valuable flu-sighting tool in the most effective way possible. So I want to echo the supervisor and the mayor in saying thank you to the Board of Supervisors, to the mayor, and to the many cities, and to the nonprofits, the Tarzana Providence Tarzana Hospital Medical Center, the many cities we're working with, the nonprofits. At this point, I'm going to announce that we have the opening of our first flu vaccine pod, our point of dispensing. It is open right now, and we'll be happy to take your questions. Thank you.